Dr. Bauman. Next, we are going to go to the hair restoration patients.
If you look at the frontal part of the hairline, this is a very, very common type of patient that we see in our practice. We treat many men who are receding in the hairline, losing frontal density up front from male pattern hair loss. So I'll tell you a little bit about his case. Martino is 43 years old, and he comes in with this significant hair loss, and he wants to protect what he has and restore the hairline to a more youthful location. And so what we did is we started him on a regimen of medical therapy to stop the progression of the hair loss. So we use a combination of oral treatments, topical treatments, as well as PRP into that frontal area, all the way back into the mid-scalp and crown, which are at risk for hair loss. And then of course, in the areas where the density is very low, we're going to do some degree of transplantation. And you see him in the healing process there. That's the middle photo. That's 1 day after the procedure. Those crusting and scabs are going to last for about a week. In the back of the scalp, we'll provide the photo. It's done minimally invasively, so this is without a scalpel, without stitches. We're doing the harvesting minimally invasively using an FUE approach, follicular unit extraction. And so what that means is that there's no scalpel or stitches anymore. We're taking the individual grafts one at a time, and we're implanting those in an artistic, angulated way in the hairline, so then when it regrows, it looks normal and natural and fills in the density. This is 12 months out from the procedure. You're seeing a more aesthetic framing of the face, increase in density in that frontal area, improvements in what we call the golden ratio, if you will, the frame of the forehead. And of course, it's not always about what's going on the top of the scalp that matters. If you see his big bold smile, you know that he's doing well with the hair restoration that we've provided. And most people think it's pluggy or painful. Obviously, that's not the case today. With these kinds of minimally invasive techniques, you're not going to have any discomfort. He was back in the gym in 3 days, swimming and playing golf and tennis in a matter of days after that, and back to his regular routine really in a week. And then, of course, waiting for the hair to grow after that.
And this is the result at 12 months?
This is 12-month results.
And how many grafts was that?
So this was 1,850 grafts into the frontal hairline, temples, and mid-scalp area.
And how often would he need to maintain with PRP after that? And do you use also amnio or anything else along with it?
PRP is not created equally. Obviously, there's a lot of ways to prepare PRP and a lot of different scaffolds or extracellular matrix to add to the PRP. So we're using a high-density platelet count, somewhere between 1 to 1.5 million platelets per microliter, using a dual spin process, so we're not just getting high-density platelets, but also a high monocyte concentration is preserved, and we're using extracellular matrix with that. Personally, we've been using BioD, which is a placental tissue, a human allograft that's mixed with the PRP at the time of the injection. So he had his procedure and PRP on the same day, and that PRP result will last about 10 to 14 months. So he does need to come in annually, but he doesn't need to come in every other month or every month for a repeat PRP.
Great, wonderful. As well as the biologics and medications and supplements that you have them taking.
Absolutely. So, whether it be finasteride or minoxidil, those are going to need to be continued open-ended. And he's a big fan of laser light therapy, non-chemical, non-invasive way to protect and enhance living and growing hair. He uses laser cap every day for 6 minutes, and happy camper.
Perfect, wonderful.
Do you have a question? Yeah.
So if someone like this, after the transplant case, then decides they want to go on testosterone replacement therapy, how would you advise the provider on that?
Yeah, so that's a great question. We see a lot of patients who come in either previously on testosterone or start testosterone after having noticed that they already have male pattern hair loss. And testosterone gets converted to DHT, so we know that's high risk. DHT is responsible for follicular homicide. So DHT creation in the body, if it's accelerated from additional testosterone or even just a high intensity workout regimen, you're going to start to lose more hair. So you've got to focus on that and fight the battle with some additional therapies and treatments. So we use finasteride to stop the DHT production. We can use the PRP, low-level laser therapy, compounded topical medications, and so forth.
So they can still continue the hormone replacement therapy?
Yeah, it's a tug of war, right? So we don't want them overjuiced on the testosterone. We want them on the least amount that gets them the good results that they want with their age management physician. And of course, we want to try to protect their hair at the same time.
And the new hairs are not affected?
Correct.
Right?
So the newly transplanted hair is permanent, never affected by male pattern hair loss. It comes from the permanent zones or relatively permanent zones from the sides and the back of the scalp.
Nice.
But they still need to protect the native.
Correct. The transplanted hairs are permanent, but your other hair is not. So you still need to keep on keeping on.
Yeah,
with
because
the
I
other
see that's
therapy.
where I see the mistake that a lot of people get a transplant and they think that they don't have to do anything or the PRP or supplements or anything, and then they find themselves that they need to do another one and another one. So it's important to get the message out. You have to protect the native.
And that's a recipe for disaster, because if you don't protect the hair that you have, then in the long run, you'd lose the battle. And you're gonna need a lot more surgery to fix it. Not a great idea. So we have over 1,000 patients visit our clinic per year. Maybe 3/4 of them may never ever need a hair transplant.
Wow.
Because we're protecting their existing hair. And the transplanted patients are on a very, very strong regimen of medications and treatments and measurements to know how things are working.
Perfect. Impressive.
Say one quick comment. I mean, to Dr. Bauman, this is obvious, but to people who don't do hair transplants, if you notice how the frontal hairline is not straight across and it's what we call kind of like the V-fib hairline, and how it blends into those temples very naturally, that's the artistry that he was discussing, and I'd have to give that an A+.
Thank you.